At Health Leads, we work in a couple of clinics here in the city of Chicago. We work with primarily low-income patients.
So Health Leads is a program that connects families with resources in the communities that they need that might not necessarily be medically related.
It's basically the connection between resources in the community and the families that they hope to serve.
So they include things like transportation, housing, commodities, basically anything they need to access health.
Things that can indirectly affect a person's health, but for which a doctor can't really prescribe some sort of medicine.
So a lot of what we do is kind of figuring out what the needs of the family that we're helping are, and then looking at what's available in the community and trying to see if there's anything extra that we need to do to connect the families to those resources, and then following up to make sure that they are actually able to access those resources after we've passed on the information. And we also kind of help support the family throughout the application processes for certain benefits and other sort of long-term things that they do.
The idea is that helping them with these non-medical needs has a positive impact on their health down the line.
I think Health Leads is the one organization that's had the biggest impact on my own understanding of healthcare as a holistic field.
It's taught me how different things can play into health, and I don't know, it's really given me a different understanding of what health can be like.
I didn't really know the extent to which, I guess, or the extent to which health was impacted by the biological and the social and the mental factors. So all those three things coming together, like Health Leads was the first time that I was really able to see that.
Health Leads has really helped me learn Chicago better because I travel a lot for Health Leads desk work and resource team work, so that's really helpful.
Working with Health Leads, I've been able to speak with patients, the kind of patients that I normally would not, get to work with. And so it's been really, really transformative to hear people's stories, to understand, that there are very basic things that people struggle with, that a lot of the rest of us take for granted. And so it's been very eye-opening to hear these people's perspectives, see the challenges that they face, and then work with them to overcome those challenges.
And it's also really taught me about the difficulties that a lot of families face in terms of trying to take charge of their own health and trying to get access to the resources. A lot of the things that I've helped clients fill out have been really challenging even for me to navigate, and so that was a really eye-opening experience.
I've also learned that there's a lot of different resources in communities that are working for the same things that we are.
Health Leads has also really impacted what I want to do in the future, helped me really solidify that that I really want to go into helping underserved communities and populations in the future as well. So it's really kind of shaped my career aspirations.
The kind of exposure you get to the healthcare world is very different than some of the other opportunities that exist. Health Leads is very unique because you're working there one-on-one with patients for several weeks. You're following up with them, and you're really getting to know them. And so it provides a very unique patient interaction experience that I don't think most pre-med students in this country get an opportunity to do.
So other activities I'm involved in are, I'm part of a dance troupe on campus called Upstart, which is the classical Indian dance troupe, and I'm also a research assistant in a neurology lab, and I also volunteer at Community Health, which is a free clinic for the uninsured in Englewood.
I am an RA, I am involved in salsa, lots of dancing, practices and all that.
I work two jobs. I do research and I also work for Teach for America.
It takes good time management. I would say that Health Leads is definitely one of my primary obligations, but one can obviously balance it with other obligations.
And at times it is kind of difficult to balance all those different commitments with Health Leads, but what I've found is that as long as I set aside time for it in my schedule every week and kind of make that sort of a block commitment, it's been pretty easy to manage that, my other commitments in school as well as Health Leads.
Join Health Leads.
I hope to see you guys in the fall.
I look forward to getting to know you through Health Leads.